All right, good afternoon. Thanks for sticking around. My name is Serena Rodriguez, and I'm an assistant professor at the UT Health Houston School of Public Health. I'm in the Dallas campus and also core faculty at the Institute for Implementation Science. So today what I want to do is talk to you about implementation science and tell you what we have available at the Institute for Implementation Science. So many of us in this room are familiar with the meaning behind this slide, right? It takes 17 years. There's a 17-year research to practice gap. Along the way, during those 17 years, a lot of the research that we do falls out of the pipeline. Interventions are developed, they're proven to be effective, and they sit on the shelf. Or findings are synthesized, but those findings don't translate into actionable guidelines or next steps. Ultimately, only 14% of the research that we do makes it into practice after this 17-year journey. Implementation science is the field that aims to bridge this research to practice gap and shorten that timeline. Specifically, implementation science is the study of methods to promote the systematic uptake of research findings and other evidence-based practices or interventions into routine practice. So what that means is that as an implementation scientist, I'm interested in how we can make sure that things that are effective reach the populations we want them to reach. Talk to any implementation scientist and we will talk about the thing and the stuff that we do. The thing is what we know to work. It's a policy, a practice, an intervention. It's the thing that's been proven to be effective. In implementation science, we develop implementation strategies. This is the stuff that we do to try to help people do the thing, adopt the intervention, adopt the practice, implement the policy. These are the methods and techniques that we develop to enhance the adoption and implementation of EPIs. So for me, for example, in my work, I work in substance use prevention, treatment, and recovery support services. So my thing is policies that support the use of medication for opioid use disorder. I want it to reach individuals who live in recovery residences who are in recovery from an opioid use disorder. We know that medications for opioid use disorder are effective. They've been shown to reduce the spread of infectious diseases. They reduce overdose. They reduce mortality related to OUD. They reduce recidivism for individuals who are involved in the criminal justice system. And they increase the likelihood of successful treatment. So in our homes, we have 15, soon to be 16 recovery residences across the state of Texas. We want to make sure that individuals who live in our homes who are in recovery have access to the medications. So how do we do that? What is the stuff that we do to make sure that these policies are implemented? Often we are developing operator and staff training. So what can the recovery residents, operators, and staff do to ensure that their policies are in line and that they support the use of mood? And in implementation science, we have a whole toolbox of methods and techniques that we can use to develop these implementation strategies. One of those is implementation mapping. It is a systematic process, everything from the needs assessment to developing the implementation strategy to evaluating the implementation strategy. Dr. Fernandez and I worked with colleagues to develop and to write about this process for developing implementation strategies. We also have a number of implementation science theories, models, and frameworks. We have some that help us describe the research to practice process. We have theories, models, and frameworks that help us understand or explain what influences implementation, what influences adoption. We also have frameworks that help us evaluate implementation. And the toolbox continues because we also have specific study designs that we can employ to test the effectiveness of interventions, practices, and policies, and the effectiveness of our implementation strategies to get those adopted and implemented into our settings. For example, here, there are 3 different types of hybrid designs, depending on the amount of evidence that you have for either your intervention and or your implementation strategies, kind of dictates which kind of hybrid study design you're gonna do, whether it's closer to more effectiveness research or implementation research. And we have frameworks that help us describe all of the nuts and bolts of how implementation strategies work to enhance intervention program adoption and implementation. For example, the implementation research logic model helps us visually depict the causal mechanisms of how our strategies change implementation outcomes, change client outcomes ultimately, and it really helps us synthesize those findings. When we're able to synthesize and depict those causal mechanisms, we can generalize across studies and produce generalizable knowledge. So I've talked about how we can identify factors that influence implementation of interventions. We can develop strategies, but in implementation science, we can also do additional things. We disseminate and scale up effective interventions. We can help adapt existing interventions or de-implement interventions that are no longer cost-effective or actually ineffective. And so the UT Health Institute for Implementation Science is a UT Health Houston-wide institute. We are a set of faculty led by Drs. Fernandez and Bala, who have the mission to advance dissemination and implementation research and practice through transdisciplinary translational team science. We've heard a lot about team science today, and we certainly do that in the Institute. We have 3 cores: the administrative core, which is kind of the backbone of everything we do. We have a research core, and we have a practice core. In addition to our co-directors, we have a number of faculty who are core faculty at the Institute who are all experts in different areas of implementation science, everything from developing strategies to organizational psychology to biostatistics and study design. And we come from all schools of the UT Health Houston system. I'm not going to go through this, but it's just a quick snapshot of the work that we do to show you that we work in cancer control. We have projects in Latin America, Mexico, the United States. I do substance use research. We have a wide variety of research interests, but we're all implementation scientists. We have seminar series, lots of opportunities to learn and also collaborate with us. On the website for the Institute, you can fill out a consultation form. If you have questions about anything to do with implementing your interventions, we can certainly have a conversation. We work on grant aims, et cetera, with folks all of the time. You were going to take a, I'll let you take a picture. I saw you. We also have a graduate certificate in dissemination and implementation science. So if you're interested in adding this to your degree plan, if you're a student, you're welcome to do that. It's brand new. It's 15 credit hours, and you'll get to learn all about implementation science methods. And if you're a part of the UT Health Houston community, you are welcome to join as a member. Membership is free. You get access to implementation science training and educational events. Like I said, opportunities to collaborate on new and existing implementation science projects, a connection to everyone else who is doing this kind of work, speaking at conferences, and then of course support with dissemination and promotion of publications, research, and achievements. And I have a QR code here for more information. And that is implementation science in the Institute in a nutshell.